So I will answer that question in two ways. So I'll look at it from the government, and the authorities and the people, the organizations that lead, that provide guidance and leadership in healthcare, which are government entities. Then the other part of it is to look at it from the people. I think the people are so technology hungry and so they're willing to embrace technology, that anything that would help them to be able to get access to better care to embrace it. Now, there's a significant gap between sort of the legal and regulatory bodies. Why do you kind of provide medical legal guidance for virtual consult or virtual care? How do you make sure there are laws in place to make sure that these things are not abused? How do we make sure that a care that is substandard, that the virtual care is not necessarily substandard to physical care? So those are regulatory issues but I think it's incumbent upon us, that we understand it, to now work with the governments of different countries to develop laws and guidelines and regulations to make sure we don't abuse, people are not abusing the process. I think that the Hippo as a device and Hippo as a company is very futuristic. I think that we're onto something here that even we don't comprehend yet. I think that it's high time that medicine took advantage of technology and catch up with other industries. I think that the things that we're doing on the hospital in terms of using technology using robotics to do surgeries, and using technology to create a better environment of care, using technology to improve processes. I think this is a step up to now begin to use technology to deliver care, and to now deliver care in a way that the patients want it. So virtual care, anytime, anywhere, how you want it. We're not dictating how it should be used. We're just saying this thing is available for you to use whenever, however you want it. I think that's transformational. I think we're not just doing that, we're also capturing how it is done, where are the gaps, how we're improving it, and where we have applied it. So that future generations, people that want to do something like that, they can go and look at it and improve on it. So you have a platform. So that's what HIVE does. Essentially, I think it captures the processes, the content, but also create opportunity for people to replicate it by just becoming a member of HIVE and be able to tap into the knowledge, significant package of knowledge that will be what the content of HIVE will represent in the future. There are two. I would make my concluding remarks in two ways. The first one is a personal thing for me. I think in life, we're all writing our own story. We're all writing our life stories. We're all writing our own story. And I always tell my family that, I'm going to do the best I can to create a good story. A story that on my dying bed, if I had a book to read, if I could read my own story, I will put a smile on my face. And so all my life, I've done things my way, the best way I know how. And seeing that I'm doing the best to contribute to humanity and to improve knowledge. So that's one. The second thing is that this may sound like, too socialistic, but I think every single human being on the surface of the earth should have access to basic health care. And I mean that in the sense that you should have access to decent basic health care. I'm not talking neurosurgery, I'm not talking complicated plastic surgery, I'm talking you have hypertension, you have diabetes, you have these basic healthcare issues. In our country, you have malaria, you should be able to get care for those things. And I think that's where the transformation would actually come into play with this virtual care. where we begin to talk about population health management. You take a whole population of people with a given disease, and you just intervene using virtual care, and you monitor their progress. You make sure they're sticking to diets, exercise, taking their medications on time. That's where we make significant impact. Neurosurgery is important, spine is important, but it's not as important as that population health, where we can capture people and manage their blood pressure before they have a stroke, where we can manage diabetes better before they have to amputate their feet. So those are the significant things that I believe as we begin to push, as we continue to push digital health, we begin to now manage a population of patients, prevent them. In developing world, it's too expensive. I don't think we'll ever be able to afford to provide sophisticated, complicated care like neurosurgery care. So it's cheaper for us, it's more cost effective for us to manage blood pressure and to manage an hemorrhagic stroke. So we need to find a way to use this platform that we're embracing now, digital health, telemedicine, to apply it to population health management, to prevent devastating illnesses, for people to have health sustenance instead of disease management.